The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, mommy makeovers. Big topic. Women after pregnancy, they still want to look pretty, according to my first guest. He's an expert on the topic, well-known board-certified plastic surgeon, Dr. Mo Zakhiren. Dr. Zakhiren, welcome to the program.
Hi, Randy. Thanks for having me.
All
Good
right,
to
and
see you.
we've had you on the program so many times before. I've sent you friends and family, and
Thank you.
Of course, I think you're one of the best. And just recently referred somebody that wanted a facelift, well-known celebrity, and I said, you want natural results, you got to see Dr. Zakhiren. Okay, so there's my plug.
Thanks.
And people need to know, this is a real interview. I'm not endorsing you on the show, but these are my thoughts. So, mommy makeover.
Sure.
Big topic.
Absolutely. Now, I'm sorry, before
Okay.
I start on that, you kind of asked me a specific question. I think my practice now at the 11th year is focused on 4 things which I love to do. That's liposuction, tummy tuck, breast work, augmentation, reduction, breast lift, and also facelift. And those 4 surgeries, if anybody asks me, what do you like to do?
What do you?
I would miss any one of those. I think that I can't do without any of those surgeries. I love doing them all. So I think it's a wonderful mix, and we just do really good work, and we take a lot of pride in what we do.
All right, and I should mention, for BOTOX in the desert, the best BOTOX I've ever had, and I tell everyone, Peggy,
Absolutely.
RN, is the best of the BOTOX. I mean, I tell people, they go, well, my BOTOX didn't work, or this or that. I mean, Peggy, right. I mean, it's like, she just did my BOTOX today, here in the studio. And next week, I'll be a brand new person.
She actually just did my BOTOX last week to get me ready for the show.
You have no wrinkles on that forehead.
Well, thank you. It's very, interesting because when I came to that office, I think for the first year I did my own BOTOX, and then I just kind of, slowly observing Peggy. She is the best at what she does, and so religiously she does my BOTOX.
In this economy, give me your take on why somebody should invest in their appearance.
That's a very good question because, since the 2007-2008 season, where the economic, downturn, now what we're seeing is, first of all, people got really scared, and so they kind of took a step back. But now people are coming back. I think that the American public in general is now feeling much more secure, and there's almost a pent-up demand, so they're coming back even stronger. And what we're noticing is that, the job forecast is still very tight. And so the majority of people are coming in because, they've had so much stress the past 2 to 3 years.
They've aged.
Oh,
interesting.
Absolutely.
Good point.
And where you notice it a lot is in their face. Their eyes are now more hollow, their temples are more hollow, and their soft tissues are starting to sag, their necks are starting to sag, and unfortunately
makes them look tired, by the way, too.
Absolutely. And
who wants to hire a tired guy or a woman?
In the workforce, it's very unfortunate, but it's true. If you look tired, then perception is reality, essentially. So a lot of these people are coming in, and they're like, what, I feel like I may be getting pushed out by the younger generation that are graduating from college. And
do they confide in you like this on consult sometimes?
Right away.
What do they say? What do aging women say to you?
Let's say a realtor will come in. She'll say, gosh, it's like I feel like I'm just tired. I look in the mirror and I look tired, therefore I act tired. Or maybe if I look at myself in the mirror, then what's my client going to say? And then they say, and my managers say that I look tired. So,
Wow.
I really need to step it up. And they're really feeling that kind of pressure.
Do their bosses say you need Dr. Mo Zakhiren?
No, no, not at all. I wish
They'll get in
did.
trouble. They'll tell the labor board. And then he said I need to see Dr. Mo Zakhiren, right? That wouldn't be good. So
well, maybe.
So they're they should start doing that. So they tell you this, and what I like about you is it's not always just about surgery. Expand on that.
Well, I mean, it's a lot of ancillary services. For example, our estheticians, or Peggy, who does our BOTOX, Juvederm, Restylane, Dysport, things like that, or Sculptra, so it's a lot of different things. And I mean, we now do the micro laser peel. We actually have a very good series of patients that come in for fillers on the back of their hands. And then we have an oxygen infusion machine that is wonderful.
I heard about this.
Oh, it's a beautiful...
You told me, well, I love it, in the green room, you say, Randy, you got to see an esthetician every month.
Yeah.
I never believed that it works.
I know, and you know what? Honestly, I didn't used to believe in it either.
Your skin looks good.
And when I came to this office, I was like, oh, whatever. I'm a guy. I don't need that kind of stuff. Yeah. Well, the ladies slowly started putting me on the schedule. They'd sneak it into my schedule, and I'd be like, what's this all about? So I started going in for my facials, and now I actually look forward to it because, after I go into my facials, I get compliments. People say, God, you look really good. You just look
your skin does look good.
Thank you. So, but definitely there's a big difference between a medical facial and a spa facial. Okay, medical facial, you're looking at a whole different ball game. You're looking at apples and oranges. When you go in for a medical facial, they do dermaplaning, where they take off the top dead layer of your skin, and then they exfoliate, and they add emollients and nutrients, and they do a peel, and they really customize it to your needs and whatever your skin needs at the time.
So everybody should see an esthetician once a month. Your people. Absolutely.
Well, I mean, obviously our people, I feel are the best at what they do. But, in general, I mean, we have a lot of people that travel from really multiple nationalities, multiple states, from all over the country, and they come in and see us. Well, they're snowbirds. So when they go back to their own homes, I tell them, I go, make sure to continue with your own medical facialist, either at a dermatologist's office or a plastic surgeon's office. Because now I've been stationary at our office for 5, almost 6 years, and when I do facelifts, I see the long-term difference between people who do facials with
people
us
that don't.
And people that don't.
So you believe
they're able to maintain their results long-term. Absolutely.
Now, by the way, because most people know who you are. I mean, you're like a local celebrity now.
Right.
Is that right? I mean, do people stop you on the street sometimes?
Yeah, and it's funny because I get really shy. I don't know what to say when they stop me.
You are kind of a shy guy.
That's very kind kind of them. And
do they ever ask about me by any chance?
Absolutely.
All the time?
They say that Randy Alvarez guy.
I'm kidding. No. What's he like? No, I'm kidding. So I'll give you some of my business cards.
Absolutely.
So, okay, mommy makeover. What defines it?
Well, in our practice and in my mind, mommy makeover is sort of like when the mom comes in and during the first consultation, I take a look at them. Most of the time, pregnancy really ravages the body if you think about it. The effects of estrogen on the body is that the body really kind of softens up. In preparation of getting the pelvic bone softened up so that, the baby can be born. But, the after effects of it is such that the body's softened up, the belly kind of pooches a little bit, they get the love handles, on the back, and their breasts, whether they breastfeed or not, their breasts will always, soften up also. So what we tend to do is, we address the love handles or the liposuctioning of the whole back area. And, what I tend to do is I concentrate on also liposuctioning the pubic area, which nobody else seems to address. I don't know why.
Why do you do that?
Well, because if I do my job well and I tighten everything up, then the pubic area, if I don't liposuction it, it pooches out.
Interesting.
Because, in my hands, I make my incision low. I make kind of either a French cut or Brazilian
for the tummy
bikini
tuck.
Cut. Absolutely, for the tummy
You like
tuck.
them low. Okay.
Yes, because the low incision, what it does is has multiple additive effects. It gives us a very nice perineal or vaginal pull, so it rejuvenates that area, but it also rejuvenates the anterior thigh area. It really pulls up on the anterior thigh, so, kind of like the dimpling and things like that really gets resolved.
Because after pregnancy, women, they still want to look pretty.
Oh, my gosh.
I think guys forget
Absolutely.
that part. After the kids and all that stuff, you still want to look pretty.
Absolutely. And
or feel pretty, I should say.
And it's very interesting that you say that, because usually, a few of them, their husband will come in with them, and the husband's just sitting there shaking his head going, I don't think she needs this. I don't think she needs this. But after the fact, when you do the tummy tuck, when you liposuction their love handles so that you get that hourglass silhouette and the small of their back comes in, and it really kind of brings out their buttock area. And also if you, end up doing breast, augmentation on them, then the husbands come in and, there's a light in their eyes. They're like,
They have their old wife back.
Yeah, and then, it's funny because some of the wives complain that the husbands chase them around the house too much.
Is that right? It's amazing. And our program airs throughout the United States now and in Canada, but we always talk about looking younger with the face. Mm-hmm. But when you do these things to the body, mm-hmm. you're giving them a younger looking body.
Absolutely.
As well.
And the thing...
you can take 10 years off the body.
Yes, absolutely. And the thing that we tend to do is we tighten all of the muscles, the abdominal, fascia and the muscles in that area. So what it does, I tell my patients the biggest benefit that you're going to have from this is as a result of tightening the muscles. Well, first of all, a lot of our patients come in, they've had large pregnancies or they've had twin pregnancies where they have a hernia around their belly button. They have stretch marks. It's just, they really look beaten up after their large pregnancies. We tighten the muscles and we give them a very athletic abdomen. We give them a very athletic body, and they come back and they're just in tears. But as a result of tightening the muscles, we're giving them kind of an internal corset. So essentially what that does...
Like a girdle.
Mm-hmm, and then what that does is that puts the abdominal wall next to their stomach, so when they eat, they fill up much faster.
Is that what they tell you?
Mm-hmm. Well, I just know that, as a matter of fact, right away after surgery, they can't eat. They can only eat 1/3 the amount of what they normally ate. And so the food gets pushed out of the stomach faster and their metabolism gets revved up. That in combination with, in women, fat cells produce estrogen. So when we liposuction their back, their estrogen cascade settles down. And estrogen also sends a signal to the body, says, slow down the metabolism, hang on to all the calories that we can. So for the next 6 months after surgery, their metabolism gets totally revved up. And they come back, they're toned up, and their eating habit changes. They have no longer...
This gives them the leverage.
Oh, huge.
And by the way, if you're just tuning in, we're talking about mommy makeovers with board-certified plastic surgeon Dr. Mo Zakhiren. Okay, so breast, maybe addressed, tummy tuck, mm-hmm. liposuction.
Right.
Okay, and you're talking about, after pregnancy, big stomach, the muscles pull apart, and
right.
you literally surgically pull them together with the tummy tuck. Mm-hmm. Low incisions.
Yes, and then the other thing that we really pay attention to is the belly button. The belly button is what I call the unsung hero, and I've said this to you before.
You have, and I get bored every time you tell me. Because I don't know what you're talking about. No. By the way, real fast, I'll interrupt you and let you finish. That you showed me pictures of belly buttons with tummy tucks.
Right.
How they're stretched and flat.
Right.
Now when I go on vacation, mm-hmm. and you can imagine I travel a lot, right?
Mm-hmm.
No, I'm kidding. But I go and I see these tummy tucks all over the place.
Right.
But yours don't look that way. So what are you doing to the belly button to give it a natural look?
Well, everybody else leaves their belly button as a floating belly button, and it just kind of pooches out. But I don't want to give away my secret, but essentially what we do
on how you do the belly button.
We tack down the skin around the belly button, so the belly button then becomes an innie. And that's the key. So the scar that goes in around the belly button is actually on the inside, so it's not noticeable. So essentially our patients can wear a two-piece bikini and they can look wonderful and they don't look like they have any scars. And everything looks great.
You like the tummy tuck?
Oh, I love the tummy tuck because...
But what about incision scars though? Isn't that, is that a big...
Actually, yeah, and since the last time I filmed with you, a lot of things have changed. Okay, for example, when Dr. Habash came on, the good thing about having another very well-accomplished surgeon in the practice is we compare notes. So after talking with Dr. Habash, I've switched to all new stitch materials.
Really?
After the fact, so I sew all my deep stitches with new stitch material that lasts longer, so that scar does not have a chance to spread as it's healing. So the tensile strength of the stitch is very high, so that scar doesn't stretch. The other thing that we do is, now our patients use a silicone tape. We have them order it online, and they apply that silicone tape onto that scar for the next 6 to 12 months at 12 hours a day. The other thing that we've noticed is that a lot of times, these sexy underwears with the frilly material and things like that, unfortunately, that
can irritate that incision?
Yes, because in order to preserve that material and keep it nice, they actually have to put formaldehyde in it as a preservative, and formaldehyde will irritate that scar.
Interesting.
So those issues are very important.
So little tricks here.
Absolutely, and
because your people could be in a bathing suit in weeks.
Absolutely, yeah.
I mean, because these incisions are low. I mean, I've seen the pictures.
Mm-hmm. And then the other thing is, for example, our Brazilian patients, they don't like scars. Or, the models that we do, they don't like scars. So we refer them to our makeup artist, and, they get kind of tattooing and things like that of their scars, and then it just blends in, and it turns out to be a beautiful result.
When they come in, by the way, okay, so do you always combination the liposuction with the tummy tuck on the mommy makeover?
It depends.
Just depends on the person.
If they need it, I just kind of look at the person now. I think at 11 years out of practice now, the thing that I've noticed that started happening at about the year 7 to year 8, now I look at my patients and I already envision the end results.
Really?
It's like they're...
Do you know if it's going to be a great result?
Oh, yeah. Absolutely.
Are you getting a fitter patient these days? Like more in shape, or maybe even a heavier patient? Are you getting the other way?
Well, I think when I first started, I was getting a kind of an older clientele. But as our name has gotten out, what I've noticed is that now we're getting a younger clientele. I'm doing mommy makeovers as young as 24, 25 years old.
Really?
And it's very interesting because I think 10 of our mommy makeover patients have been young enough to where they have become pregnant after their surgery.
Interesting. So, do they bring in their partner? Do you encourage that?
Oh, yes. We encourage that, and we, during the post-operative period, we have them come in with their husband or significant other, and we make sure that the partner is involved and well supported. And I'll tell you why. It's because, as I told you, after the fact, their eating habits change, their cravings for carbohydrates or sweets or French fries, whatever change. And so I always tell their partner, I say, you're the one that has to go along with this, and if you go along with it, you're going to benefit from it too. So I actually have a lot of the proactive husbands thank me after the fact. They're like, I thought this was all hocus pocus and you were trying to sell us on surgery, but I myself have lost 25 pounds. And I tell you, I get goosebumps when they tell me that.
Is that
That's
right?
What it's all about.
You're changing lives. I mean, we always say that cliche, you're changing lives. But do you see transformations where somebody comes in, maybe they just feel sloppy or frumpy or whatever the word for it is? Mm-hmm. You do your work, maybe the breast, the tummy tuck, lipo, and all of a sudden now they're dazzling again, dressing differently.
Yeah, and it's funny.
Do you see that?
Absolutely. The last time I had family in town, talk about looking like a rock star, because I took them on the bump and grind, and we were going up the bump and grind, and I'm not exaggerating, but I got approached 3 separate times by patients, 2 of them mommy makeovers and 1 breast dog, saying that, Dr. Zakhireh, thank you so much. You've changed our life.
Is that right?
It was really neat to see them on the bump and grind. They were on their way down as I was on my way up. And my family's like, who are you? Who are these people approaching you?
They don't know who their own son is, your mother. Then they realize you have to take them to the bump and grind.
Yeah.
You probably did that on purpose.
My mom doesn't get up to bump and grind. She starts complaining.
Your mother looks like your sister, by the way.
Oh, thank you.
You did her facelift. That's an incredible result.
Yeah.
That was one of the, in fact, that facelift could almost go down, and you could show that at plastic surgery meetings. That's probably one of the most natural results in history.
Thank you.
You got lucky on that one, I think.
Well, no, I didn't get lucky. What happened was my mom and my aunt approached me. They wanted me to do surgery on them, and I said, absolutely not. That's not the way I was trained. I referred them both to very good people. They both got botched. My mom on a tummy tuck, my aunt on a facelift. Now they were not only disappointed, but they were mad at me, so I had to fix them. So I fixed my mom's tummy tuck. I fixed my aunt's facelift. And actually, you know what? This brings up another good point. You know, usually when I do my tummy tucks, the patients do so well that they lose weight in their face. So I usually like to do a tummy tuck liposuction combination first and then come back and do a facelift.
You know, one of the things that you mentioned to me, which I thought was very interesting, instead of throwing away the fat, you say that they're there, you add it to their face.
Right.
What do you mean by that?
Okay. So first of all, you reminded me of something else that it's my pet peeve, and the team at the office knows it.
Okay.
I have to address this area with the liposuction tummy tucks because, you know, essentially because of hormonal changes, women gain a lot of fat in their bra line, and they hate that.
Yeah.
And nobody else addresses that. So anyways, but that's an area where we take that
You
fat.
lipo that area?
Oh, I lipo it, and I mean I lipo it flat.
Wow.
And then
you're aggressive.
Yeah. Well, I mean, I've learned throughout the years where to be aggressive and where to be conservative. Okay. That's very important, Randy.
All right.
But we take that fat, we spin it down, and it's high quality fat, very dense fat, and we separate the oils, and then we usually will graft it either to the face if they have hollowing of their tear troughs. Mm-hmm. I even add it to the dorsum of the nose if they have.
Really?
Oh yeah, if they have like a dorsal hump, and I will add it to the brow ridge so that they get a very nice arch to their brows and nasolabial folds and even the lips. And, you know, the thing is in the right hands, that fat takes. It actually becomes permanent.
Do you think it's better than Restylane, better than those things for under the eyes?
Yes. Anytime we have patients, and Peggy will tell you this, anytime we have patients, if
Peggy's your RN, for people just tuning in, we're talking about mommy makeovers.
Right.
Okay.
Peggy's our, injector nurse. And anytime we have patients where they have fat, we like to encourage them to do fat. Why? Because fat is living, breathing tissue. The body grows blood vessels into that fat, and then that fat, takes. Well, indirectly, what it's doing is it's increasing the blood supply to the underside of the face. Okay? By increasing that blood supply, you're physiologically rejuvenating that area.
The whole area gets rejuvenated.
So for the next 6 months, the skin on the face is getting rejuvenated.
Are there stem cells in there, by the way?
Exactly. And that's what this whole debate is about. Well, we've been doing fat grafting for a long time now, and we've known that there's stem cells, at our practice.
Those bags, hollows under the eyes. This is a perfect area. And by the way, I should say, I'm endorsing you a lot, but I just interviewed another medical doctor. She looked haggard. I shouldn't even say that because she watches this show even more than I do.
I'll tell her you said that.
She comes in, unbelievable.
Thank you.
And now I said I have to do it. I have to do it.
And I know who you're talking about. But
she looks fantastic.
The skin for the next 6 months is in transition. The pores tighten up. The collagen content increases. The fine lines go away. So it's really amazing.
So fat to the face, breasts, tummy tuck if needed, liposuction.
And also fat to the buttocks. A lot of people now are looking for the Brazilian butt lift. That's what it's called. And I tell them, I go, it's better to do fat rather than put a solid...
Where do you put it? Where do you put it, though?
In the upper pole of the buttocks, and so what we do is we shape the buttocks, very nice curve, and essentially gives the butt a very nice lift.
This is only on thin people, though.
They end up looking great. Well, it's for people whose butt has fallen or sagged as a result of the extra estrogen of pregnancy.
Now, this is great stuff, but we are out of time. Okay, final message, though. Somebody watching this, maybe after pregnancy or whatever, they're not happy with their body,
right?
Even their face.
Okay, Randy, here's the deal. I think that whenever the husbands come in with the wives, they're very skeptical. But, honestly, I mean, the husbands, they have the kids, but they get their toys, they get the cars, the trucks, the motorcycles, whatever, the airplanes, the boats,
Yeah.
And the wives essentially get left in this kind of funk, where they look in the mirror and they just don't see who they were, that 22 to 24-year-old body, that youth, Wow. Now they have a couple of teenagers who kind of are leaving them. They are finding their own way. They're finding their own friends, and they don't have time for them, after this big investment. So the wives are really left very empty, okay? And our job is to essentially rejuvenate not only the body of that patient or that person, but also buoy their spirit. And that is essentially, what we are accomplishing without making them look done or anything like that. And then after the fact, the husbands come in and they thank us.
That way the second half of their life could be the best half.
It is, because it rekindles, that that beautiful lady, you know, they're beautiful on the inside, but it actually brings that out. So now they're confident, they put on a tight dress and they can look curvaceous, and they don't have that pooch, that things, you know, don't hang. So it's very important. The only thing that I want to tell you that I just remembered, we're doing a lot of fat grafting and radius to the back of the hands, and then we're actually doing erbium laser, and I mean, it's rejuvenating the back of the hands, even the forearms.
Hands are really a problem, huh?
Huge, huge, especially
young face,
in the
old
desert.
hands.
Yep, especially in the desert, you know, because we're
get it done.
Kind of people are sleeveless. But you know, I mean, this is probably by far the most exciting time to be doing plastic surgery if your surgeon is knowledgeable and they care about you, they do things safely. And that's the other thing is, you know, the combination of these surgeries I'm talking to you about, I can't do all these surgeries at once. You know, I can only do, let's say, liposuction, tummy tuck, and breast work. You know, my safety limit is 5 to 6 hours. I don't like for my patient to be on the table longer than that, and they heal much faster, the shorter the surgery. So we kind of plan things out for them. We have, you know, a customized approach for the patients. And, you know, when you tell somebody, I can't do everything on you at the same time because of safety reasons, what are they going to say?
They can't argue with that.
You know?
What are the older patients? I mean, you have people in their 60s, 70s?
Absolutely. I just actually did a facelift. I just did a facelift on a 72-year-old patient. I've done liposuction tummy tuck, you know, on a 60, 65, 66-year-old. So yeah, I mean, if done right,
get a consult. You know, your consults are still free?
Absolutely.
Okay, good.
We really, both Dr. Habash and I, we really take pride in educating our patients. And we always encourage them. We say, go and seek other consultations after we have educated you, because we kind of help bump up their knowledge to that one more bar, and then they can actually ask educated questions of other people.
All right. Well, I want to thank you for coming to the show. Great stuff.
Thank you.
Always
very
a pleasure.
Much. It's always great to see you.
Time flies when you're on the show, and,
well,
you look fantastic. So thanks again.
Thank you, Randy.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you can visit our website, put in Dr. Zakhireh. That's pretty tough to spell. So you could just put in the... Dr. Mo,
CSI.
That's your first name, but yeah, CSI. Put in CSI. We'll do a search for CSI. That's Cosmetic Surgery Institute.
Of Palm Desert.
You can show your friends of Palm Desert. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.